Hello, this is Dr. Siddharth Roy. Welcome back to my channel. Today let's talk about chronic headache, migraine in men and women. Let's start with the sign and symptoms. The headache arising from a migraine with or without an aura may have the following characteristic. There is often throbbing, pounding, pulsating pain. The pain often arises from one side of your head. It might shift to other half of your head or may remain on the same side. The pain is often concentrated at the sides of your forehead. The pain may last for 4 to 72 hours. Now, there can be few symptoms that are present at the time of headache or before. What are these? Nausea or vomiting, vertigo or lightheadedness, fatigue, irritability, noise, light or movement, in particularly bending forward, might increase the pain. You may prefer to lie down in a dark, quiet room. There can be tingling or numbness in other body parts, visual disturbances like seeing of zigzag lines, dazzling light, or temporary blind spot. There can be few symptoms that linger even after the headache is gone. These are mental confusion, which is inability to think. There can be neck pain and sleepiness. Now let us talk about the causes of migraine. Researchers are not sure about the cause of migraine, but it is believed that it causes change in blood supply to the brain. They also believe that it has some sort of genetic connection, as in most of the people who are suffering from migraine already have an affected family member. Now let us talk about few migraine triggers. Alcohol, particularly beer or red wine, few food items which are rich in monosodium glutamate, pickles, milk, cheese, etc. Crying, too much or excess of sleep, consumption of caffeine, smoking or inhalation of the smoke, excess of heat or humidity, bright light, loud noise, fluctuation in hormones that occurs during the time period of pregnancy, before, during or after menstruation, exposure to a strong odor such as perfume, excess of physical or mental stress. Few medication can also cause migraine. These are the few important triggers that should be kept in mind. Now let us talk about risk factor. Women are 3 times more likely to get migraine than men. Age below 40. It is believed that with increasing age, migraine tends to reduce. Already having a family member who is affected with migraine, potential sensitivity to the triggers which we discussed before, and lastly, taking of birth control pills which might alter the estrogen level. So now let us talk about the homeopathic treatment approach for migraine. Homeopathy offers wonderful treatment for migraine. We'll be discussing few of the drugs. First of all, starting with belladonna, which is indicated in congestive headache, redness of the face with throbbing and pulsating carotids, worse by slightest motion or noise, better by pressure or bandaging. Next is gelsemium, the headache arising from the nape of your neck, extending up to your head and settling over your forehead and eyeballs, worse by mental emotion and smoking. And lastly, natrum meo for school-going girls from sunrise to sunset, associated with nausea and vomiting. And yes, don't forget, we are still in the pandemic. Get yourself vaccinated, maintain social distancing, wash your hands regularly, and yes, most importantly, mask up. Do follow and subscribe our YouTube channel, like us on Facebook, and follow us on Instagram. Thank you so much.